Professor Eslami, I have been searching the internet for a periodontist and implant specialist with a strong academic background. I came across your name. Your credentials and accomplishments caught my eye. Therefore, I'm requesting this interview.
It's my pleasure to talk to you and answer your questions.
Please tell me about your background and professional training.
Well, I'm a periodontist by training. I was trained at the University of Michigan in 1981 under two of the most reputable names, Dr. Ranford and Cafesi, and then joined Marquette in 1981 until 1991. I held positions like the director of the periodontal clinic and periodontal surgery. And then in 1984, I started my private practice, limited to periodontics, treatment of gum disease. And then in 1991, I actually became full-time in my practice.
When did you become interested in dental implants?
Well, having been a periodontist for a long time, I realized there are times that we could not do anything for patients who were losing their teeth, or there are patients that they were coming to us and they had already lost some teeth, and the idea of going to denture and artificial teeth was really not very appealing to them. And that really piqued my interest, and I got my training in dental implant in 1990 at Northwestern University, and started seriously working on it and offering it to my patients in 1994. And ever since, my interest in implant has grown on a daily basis.
Would you tell me what is a dental implant?
Well, it's a very good question, and sometimes it's misunderstood by people. Dental implant is really a replacement for the root of the tooth. So it's not a tooth, but rather the root, and it's closest to the nature. Dental implant is a titanium device, and you may consider it as a miniature orthopedic appliance, which is placed in the jawbone, and then after a period of time, when the healing has happened and the bone has fused to the implant, then a tooth, an actual tooth, is made on top of it. So there are patients who come and they show me their implant. In reality, they're showing the crown of the implant, because implant cannot be seen. If you can see an implant, there is something wrong.
What is the process of dental implants for people who've already lost their teeth?
Well, loss of teeth actually causes bone loss, because the jawbone has a jaw, and the jawbone is really to hold the teeth in place. And when one loses his teeth, the jawbone has no function, so it gradually deteriorates and diminishes. Therefore, when a patient comes in and they don't have teeth, we ask them some questions as to how long they have done it and their desires. And then, of course, we have to qualify them to see if they have adequate bone. Therefore, after the initial interview and exam, we request a 3D imaging. The 3D imaging allows us to see the bone in 3D fashion, and then choose the best place for the implant. And obviously, nowadays, the technology allows us to even build the bone. So that, at this time, is really it's not an issue, so we can do that. And after we qualify, we come with a plan, and then talk to the patient, give them different options, and again, in the interview, we ask them whether they want to have something which is permanent, that means it's fixed to their mouth or can be taken out by them. And after all this, we come with a final plan and proceed with the dental implant.
And tell me, what about people who have teeth that need to come out? What would that process be?
That probably is a better situation, because hopefully they have not lost a lot of bone. Of course, many of these patients have already had gum disease or periodontal disease, which, as we know, it ravages the bone around the teeth. We still interview the patient, understand their desires, and we definitely have to know that they're going to change their ways, because there is definitely a reason they're losing their teeth. It's lack of brushing and flossing. And many times we also request for 3D imaging, again understand how much bone is left, and analyze their case, and then come with a plan. And then after we come up to a conclusion as to the final plan, we proceed with the treatment.
Imagine a patient comes to you with a broken front tooth and they're in a bind. Can they be helped?
Definitely. In fact, it's very ironic. Literature usually says that a dental implant needs to have some time to heal, and therefore it cannot be put to function. I remember a day that I had a patient came to me, and she had to go to a wedding that weekend, and she definitely was in a bind and wanted to do something. So it's really one of the first cases that triggered my interest. It was a front tooth. We took the tooth out and placed the implant, and that same day, actually, I fabricated a temporary crown for the patient. Obviously, the healing is there. It's a biologic event, so we cannot really circumvent that. So what we do is we make the tooth as close to natural as possible, but it remains non-functional. And the patient definitely understands not to eat and put that tooth to use. And doing many of those cases, I realized that actually the implant heals better, the tissue looks much more natural, and the end result is much better than if you place the implant today and did not place a crown on it in some time later, because this actually, in this way, the tissue gradually recedes, and the end result will not be as pleasing aesthetically as we did the first day. Initially, it was taking a little longer to do. Of course, I've done many of them. That has become one of my subspecialties. And nowadays, we call that tooth in an hour in my office, and that's the real thing. We can do it often in less than 1 hour.
Now you said that was a temporary crown that you placed on there. When would the permanent crown go on?
Great question. As we said again, the implant should heal. And obviously, we would like to restore health and function as the nature intended it. And that, again, the first day, we cannot place a permanent crown. First of all, because the implant has not integrated into the bone, so it cannot be put to function. And second of all, the tissue is going to go through some healing. So it takes about 4 months for this process to complete. And then at that point, patient is referred back to the family dentist, and then they will take that temporary crown out, take impression, and make a final crown, at which time the patient can put that to full function.
For people who are currently wearing dentures and don't like them for maybe a loss of taste or fear of them falling out, are there any solutions with implants for them?
It's definitely the solution is there. Nowadays we know a lot more about dental implants. This has become my passion recently. There are buzzwords out there about what they call all-on-4, all-on-5, all-on-6. Basically, we still have to talk to patient, interview them, understand their desires and what they want to achieve, and then we still have to 3D imaging and qualify them. But we can actually rescue those patients, give them a minimum of 4, possibly 5, possibly 6, depending on how much bone is left and where the bone is in the jawbone. And then within the span of 24 hours, our lab will fabricate a temporary bridge which can be placed on the implant. Obviously, there's a question of function. Because the physics is a little bit different here, the implants are attached together in a U-shaped manner as the shape of the jaw is. Those patients can put these implants to some use. And the some use basically means they can eat food like soft bread, They can eat fish, pasta, but we definitely recommend them and discourage them from using these teeth to eat steaks and crust of the pizza until the integration has happened. And that again takes between 3, 4, 5 months depending the initial status of the patient. And then at that time, the dentist will take the temporary out and make the final bridge for the patient.